right. We should be set.
Got it.
So
Okay.
thanks again for making the time, Tom. The first
Sure,
thing the first thing I'll ask you is just what motivated you to join the Archlifter community, to get an Archlifter?
Well, as we talked earlier, being a dentist, I have a lot of back, neck problems, and being a colleague of Devin, went to dental school with him, found out he was researching this and trying to develop the Archlifter. So I said, "Hey, I'll be glad to be a test subject for you." If I'm glad I did. I was actually waiting a while to try to get the device from him till he had it to the point he wanted to release it, But
Right.
yeah, that's the main reason, with the back and neck problems.
Yeah, very cool. And is that something that you think was caused mainly by like the work that you do as a dentist?
Oh, no doubt. I mean, in high school I played football, so I had some neck issues with that, but the majority was from our positioning, ergonomics. It's just you can't always be in perfect form when you're working on a patient.
Right.
So it helps get you back in line,
Yeah.
in my opinion. Yeah.
Yeah. How bad would you say like your pain or your general problems were? Like, was it something that was getting in the way of what you were doing every day, or was it just kind of a nuisance, but nothing bad?
Actually, it was pretty bad. I was every month I was kind of alternating. I did chiropractor, acupuncture,
Yeah.
and deep tissue massage. So I alternated all three to try to just stay out of pain, and I actually also had a device. It was one that I laid on the floor with to give me the neck stretch that my chiropractor prescribed for me. I can't remember the device because once I got the Archlifter, it kind of went aside. So
Yeah. Yeah.
yeah.
And were those the other solutions that you're talking about, or even, appointments, doctor's
Uh,
appointments, etc. Were they helpful at all? Was it temporary, or was it just totally unhelpful?
yeah, the chiropractor, the initial gave you the release, but it was not long lasting.
Okay.
Uh, Acupuncture kind of got more of the muscular and the deep tissue massage. Now, since with the Archlifter, I only do deep tissue massage. I don't have to see the chiropractor anymore. If I want to go for acupuncture, just for relaxation, I will, but I find better relief from sticking with the massage.
Very cool. Very cool.
Yes.
At any point, like while you were pursuing support for your back issues, was there ever a surgical solution like offered to you at all, or was it not that serious?
Yeah, not that serious. No,
Okay.
I didn't go to any orthopedics or anything like that. I tried to uh, just maintain it on my own.
Yeah.
Also bought for posture the device that kind of held your shoulders back to get you better posture. I'd wear that only at work. But I also started standing at work,
Gotcha.
which is kind of like the old time dentist. I thought back to when I was a child and my dentist stood. And I thought, well, hey, let's have something here because I have a lot of elderly patients in my practice, and the ones that said this is what started me to stand was, hey, I can't lay back that far. So I'd stand for those patients, and I noticed the more I stood, the less pain I had, and I would get, the the tension in the muscles trying to sit and work on them pretty much upside down,
Yeah.
for me. Yeah.
Wow. Very cool. So I'm curious, how long have you had your Archlifter?
Oh, geez.
And it's okay if you're not sure, but has it been like months? Has it been years?
No, it's been a few years, yeah. It's actually and I was gonna look it up for you because I did some imaging for Devin at the YMCA. I took it over there and did some photos and stuff on the machines,
Yeah.
and took some at home also. But definitely way before COVID. So
Okay.
before years, I mean, he would know better. When it's like one of his first designs. Yeah.
Yeah. Yeah. Wow. That's awesome. And has the way that you've used like the Archlifter changed? So like, did you start using it at a higher frequency and that's reduced over time? Or has it kind of been the same way you started is the same way you're using it now?
I started initially because, and I talked to Devin a lot about it. I wasn't sure how long I should, hang in it, if you want to call it that way, support my body weight. So initially I would use it twice a day for about a minute each time. And then as I was feeling better and with the massage, I just went to once a day and only for about a minute. I mean, I do have it supported on my, the overhang of my door frame.
Yeah.
Which was one of the options. So I've never totally, I didn't feel comfortable totally having all my body weight lifting my feet off the floor because I don't know if the wood would support it.
Yeah.
Not that I'm a big guy, but I just, just never took that leap,
Yeah. Yeah.
Yeah.
Totally valid. And I feel that concern for sure.
Yeah.
So, but how long do you think it took until you started seeing like some kind of improvement or some kind of effect on your symptoms? Was it immediate? Did it take a few weeks or months?
Well, I mean, I would truthfully say probably within a week doing that twice a day.
Wow.
I could feel the pull because I told you I was used to using and it was one that you would use with a pump to
Yeah.
give you the neck stretch, and you lay on the floor with that one, and the air on that would release over time, so you had to keep pumping it up, and I would lay in that to get good relief. I would lay in that for about 30 minutes.
Wow.
With the Archlifter, I would like I said, I would do it for about a minute, and probably within a week of using that, it started to give me more relief. And you can actually feel the pull all the way down your spine, which with the other device, it was more concentrated in the neck and shoulder region. Seemed like,
Yeah. Yeah. Yeah, I really appreciate that comparison there. I'm curious. I'm glad you've had a great experience with it. Is there any parts of it, maybe at first especially, that you found like challenging or difficult to use? Like for example, you were saying hanging, entirely on your body weight. That's not something you were comfortable with at first. Are there any other issues or concerns you had about the product?
And I did have to kind of talk with Devin. With the strap, getting the strap around the back of the head to support you,
Yeah.
took a little bit of tweaking, but after speaking with him, I worked that out. No big deal. And the device, and I kind of saw I think has maybe a couple different devices now, but the one I have, you can rotate the area where you put the device in your mouth.
Yeah.
And it's adjustable. Mine's adjustable, so I had to get the right angle for my head and neck.
Yeah.
So that was the only thing that really was a concern.
Yeah. I'm glad you mentioned that angle. Is that something you've kept track of over time? Like, have you changed the posture angle that you're using?
No, I haven't. Yeah, once I found what felt like it gave me the best pull, and like I said, it just pulls the whole way down your back.
Yeah.
And it's a good release of tension, and I you can just picture your spine, you know, opening up and the disc, you know, having relief, you know, so.
Yeah, I've heard Devin call that like the sweet spot, like that right angle to get you that feeling.
Mhm.
So I'm glad that you
Okay.
found yours.
Yes, yeah.
Yeah. Oh, what would you say to anyone who's thinking about getting an Archlifter? What's your general recommendation?
I'd recommend them try it. You know, to me, the cost wasn't that much of a factor. Uh, it, the other device I did use was just as expensive as this. So, and this one worked for me. So I was willing to try almost anything to get out of the pain I was having. Um, being that you're supported by your maxilla also, I know there was some, uh, through the one dental chat, there were some people that felt that was not a good thing to do, but you know, your maxilla is attached to your skull, you know, it's part of your skull. So I didn't have an issue with that. Didn't harm my teeth. If you want me to go into that part, I can. You know, the mouthpiece that you support yourself from has the silicone covering on the metal, and I made myself vacuum form custom fit appliance that goes on my over my teeth, so my teeth aren't directly on the silicone, and that gives me a little extra cushion. And I was concerned that I would my teeth would tear into that and it wouldn't last as long either. So having that extra cushion in between there, you know, I felt it protected my teeth and it protected the silicone bait plate.
Yeah. Wow. I'm glad you made that for yourself. That's definitely something I've heard from some other users
Mhm.
too. But thank you so much. One last thing I'll say is there anything you can think of that would improve the Archlifter or that would make you more fond of the product in some way?
Oh, geez.
Sorry.
I know. Uh,
It
I
sounds like,
didn't,
oh, sorry.
I'm sorry.
I was gonna say, it sounds like maybe even figuring out that mouthpiece situation. Like, it sounds like that's something that you had to figure out a little bit manually. Maybe
Yeah,
like that's something.
yeah. And like I said, I saw he was working on some new design. I'm not sure how that one um, compares.
Yeah.
But I do like the product I have now. And I like the way it is adjustable. So if someone else would want to try it, you know, and it comes with different size mouthpieces. Um, but I think they have a good design, or just you know, the good product. And it definitely gives you relief of the neck and back.
Great.
As far as,
Great.
yeah, I can't think of any improvement.
Yeah.
Um, I'm sure Devin is always trying to make it better, you know, so, um,
Yeah, definitely.
but
Cool. Well, thank you so much again, Dr. Walters. We really appreciate your time.
sure, Arvin.
I'll go ahead and stop the recording now.
Okay.